So I think it's important that you understand the clinical trial process. I'm not saying that the pill is bad. I just want you to think about how to make health decisions for yourself. You want to be especially vigilant, especially staying on top of it. Once I got the information I needed, I started to move in that direction, how to make health decisions for yourself.
In your mind, what would you say to brothers that's not vaccinated or just people in general?
I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do. Hey. Welcome to Keeping It 100, where we have these open and honest conversations to make sure you have the information you need to make good health decisions. I'm your host, Dr. Kristin Motley, and as always, we have a wonderful show in store for you. Dr. Tyan Thomas is behind the scenes. I don't know where the street practitioner is, so she's going to be in front of the scenes. So, Dr. Thomas, hi.
Hello.
I'm glad you're always available for a last minute co-host session.
Although I don't know why I can't see myself.
Oh, me either. I don't know. It was just
Yeah.
good. Let me see. All right. Well, we can hear you. That's what matters.
All right.
We know you look good on the background.
Ready to go. I'm here. Oh, wait. Yeah, start camera. Reading is fundamental. Hello.
Oh, goodness. So let's just get into the news. Last week I had mentioned that there's some concern that monkeypox may make its way back into the scene because there was a pretty substantial outbreak in Chicago a few weeks ago. Some of the people were completely vaccinated and some were not vaccinated at all, and some only got one dose. So I want to remind everybody, the monkeypox vaccine is a 2-dose vaccine. So if you only got one dose, you got to make sure you go back to get your other dose to have adequate protection. And just like what we see with COVID, it may not 100% prevent you from getting monkeypox, but you won't have as bad of a case as you would if you had no protection at all. Have you been hearing anything about this, Dr. Thomas?
No, nothing except for what I've been learning from the podcast. But yeah, like you said, if you're going to do the one, you might as well go ahead and get both of the vaccines. And it looks like that second one is you have to get like a couple of weeks later. So just making sure you time it. But it's here, and just another thing we have to be aware of, right?
Just another thing, and just stay vigilant, especially for people who are high risk. And you can go to the CDC's website to see what your risk is. I just want to give a special shout out to men who have sex with men, bisexual men, just because we know that in a lot of the cases, that's the group of people who have been impacted the most. So please, especially my brothers, please make sure you are vaccinated against monkeypox. The good thing is that it doesn't cause a lot of people to die. Nothing like COVID, which is great, but it causes a painful rash that makes you have to miss work. So it's chipping at your coins. You don't have time to be missing work and can't go out. It's the summertime. It's nice out. So make sure you're doing what you have to do to stay protected. Now, last week, we lost a legend, Tina Turner, an amazing, iconic woman, paved the way for a lot of women that were dealing with the domestic abuse. I was reading an article that she had high blood pressure and she didn't want to take the prescription medication to control it. And she was using natural medicine. I think you sent me that article, Dr. Thomas. And so I saw that she had posted this on her Instagram last week. Well, like a few weeks ago, like last month. If I had known how high blood pressure and kidney disease are connected, I would have been spared a lot of suffering. R.I.P. Queen Tina Turner. But I do want to let you all know, if you do not know, that kidney disease and high blood pressure are directly connected. A lot of us are on dialysis because we did have high blood pressure that was not adequately controlled, that turned into kidney disease. Dr. Thomas, you see this every day at work. Do you want to talk about it a little bit?
Yeah, sure. So I think she had posted that as part of April was Kidney Health Awareness Month or something like that. And
Mhm.
yeah, so hypertension, high blood pressure is called the silent killer for a reason, right? I mean, many people have no symptoms. Some people might just have mild symptoms, like a little bit of a headache and things like that. And it's one of the easiest to treat kind of chronic medical conditions that we're living with in the US. And there's so many medications on the market that you can find what's right for you. But I have seen people who have had years of untreated hypertension or high blood pressure, and then just after a while, their kidneys just can't take it anymore. So slowly, kidneys start to not work as well, and then once you get to a certain level of kidney disease, then other medications that help the kidney disease come on. So I always try to tell people, like, take the one or two medicines now so you don't have to take the 5, 6, 7 medicines that you need because your kidneys aren't working as well, or because you had a heart attack or stroke, and so just take it. I know there are a lot of, stories out there about how blood pressure medications can affect other things like libido and things like that. But, having a heart attack or stroke can affect those things way worse as well. So just be vigilant, and also eating right. A lot of those other things work as well. But at some point, sometimes our bodies are just at the point where diet and exercise alone can't do it, and so just very important. It's one of the easiest treatable conditions, and it can cause so many problems when it's not treated. So
So true. Well, thank you for dropping all that knowledge. It's the last day of Mental Health Awareness Month, and this is our last mental health show for the month. All month, if you haven't checked out the previous episodes, we have had on a therapist or a person that has addressed mental health, and it's been an amazing month. And so this show is no less. We are joined this week by Dr. George James, who is the CEO of George Talks, a communication and consulting company. He is a licensed marriage and family therapist, executive coach, corporate and media consultant, relationship and parenting expert, mental health ambassador. He has been an expert guest on a number of news outlets, including the Today Show, CBS Mornings, Nickelodeon, Good Day LA. I don't see Fox News on this list, and I'm a little concerned. But he been in these streets,
Is there?
y'all. Hey, Dr. James.
oh Lord, how you fit all that on a business card?
Listen,
That's what I
I'm out
want to
of
know.
breath. I can't even talk. Oh, and he is the host of Leapcast podcast. So he just got a lot going on, and I'm really, really excited to have him here. And full disclosure, I'm gonna let my business out in the streets. He is my therapist. He has been counseling Bilal and I for, I don't know, 6 or 7 years now. It's been a long time. So he knows my business, y'all. So we ain't gonna talk about that today. It's all good.
Oh my
You
goodness.
always out yourself, right?
Yes, she does.
It's okay. We got to be vulnerable. We got to let the people know that we could appear like we got it going on, but we really don't have it going on. And I think I have told people that I was in therapy with Bilal when the therapist, you, told me that I needed my own therapy. And I was like, really? So he the one that made me go to therapy, y'all, in case y'all wondering it was him.
I might have said a word or two.
But thanks for coming on today.
I'm glad to be here. Thank you so much. Dr. Motley, Dr. Thomas, thanks. Appreciate it.
Yeah.
Glad
So we just kind of want to start at the beginning. Everybody's talking about therapy now, and which is great. And we want to have more conversations about it because I feel that everybody needs a therapist. But I wonder, like, what are the things that happen to get a person to really consider, I'm going to go see a therapist? Like, what is the trigger?
Yeah. First, I love that so many more people are talking about therapy, talking about mental health, or really recognizing that they need to do something about it. Usually, what gets people in the door, gets people to kind of call me or reach out to me in some way, is some form of crisis, some form of issue. There are these entry points, right? Right, where it's your work life is just falling apart. Like you're frustrated, you're annoyed, or you don't feel like you're able to move up, and you're like, and you realize this has happened to 2 or 3 jobs, and you finally start to say, well, is it something about me, right? Or it could be your relationship, something you want the relationship to work, but it's not working, at least the way you think it should in your mind. Or you recognize that some stuff you've been through in your family is now kind of catching up to you, just affecting you, or you've experienced some other trauma or some other challenges. There's also some folks that I love when they come in, because it's not necessarily a crisis. It's more of, you know what? I want to explore. I want to like dig deep and talk through some of this stuff. Or I've had a lot of people that have come in where they're looking for, and there's actually a mentee of mine that gave me this phrase. They're looking for a thought partner, right? A thought partner, someone that, look, I can't really talk to that many folks, or I don't know who I can talk to, but I want someone that I can feel safe and comfortable with. Those are some of the entry points. And then from my side, one of the places that I kind of focus on is really helping those people who feel isolated and alone, leaders, entertainers, athletes, performers, people who are doing a lot, doing the most even in their life, and they can't talk to their partner, they can't talk to their children, they can't talk to their employees or direct reports, they can't talk to their teammates, and they need somebody. And that's where I come in. And really, I'm trying to help them navigate parts of their life in business and in love, or sport or career and in love. And love could be romantic relationships or even their family life. And that usually one of those areas is off. Sometimes both of those areas are off and they need some support.
That's good, because I surely came in crisis. I'm like, this marriage ain't gonna work out. I don't
Not
know.
in crisis.
We was definitely in crisis mode. I'm like, when is he
It
going
felt
to
like
leave?
crisis. I saw some folks in crisis, but yes, you
Yeah.
were leaning towards crisis.
Yeah, we were heading there for sure. We were definitely heading there.
So Kristin mentioned about then also going into a separate individual therapy. So what kind of prompts that? Is it something related to one partner not feeling, fully secure to express true feelings in front of the partner, or like how does that happen? How does that take place where you get that separation?
Yeah, so I think it's, probably similar in maybe any field, right? Like if you go to your general or your primary doc, that person might say like, well, I think you need to see a specialist because this thing here could be addressed more with that person. That yes, I can help you a bit, but if you go to the specialist, that can be further addressed. And it's thinking about individual therapy as the specialist. So if they come to me for the couple, I'm saying I can see you and work with you in your couple relationship. But there might be some stuff that you need to really dig deep in and talk about for yourself. And you might need to go see somebody else for that. Yes, I can help you. Yes, we can talk through some of that. But if you have your own person, you have that whole time just for you to really to dig in on that. And oftentimes what it is that some of your personal stuff is coming up in the relationship. So if you've had negative relationships, if you've had some trauma, if you had some bad, negative family history, that stuff is going to show up in the relationship. And even though we're talking about it in the couple stuff, we might not be able to get to the full part of it where you can do an individual. So that's one way. Another place is, yeah, there's some things that maybe I don't have enough time to talk about it, say in a couples work, that in couples therapy, you're sharing space with your partner. It's you and the other person and the therapist for the most part. And even in 50 to 60 minutes, you might leave feeling like there's so much more I wanted to say. And that's where like individual therapy can help you to kind of not only say it, but to process it and to really say like, oh, maybe it's not really my partner. Maybe I've just always felt left out, or maybe I've always felt ignored, or I realize rejection really does trip me up. And like when we talk about sex, that feels like rejection, but it's not really sex or my partner. It's really I've been dealing with rejection throughout my life. And so that's where the individual therapy allows you to kind of like uncover that and unpack that. And so there's lots of different entry points. Probably as a therapist, we all or most of us will believe if you have that individual therapist and the couples therapist, that's the best kind of fit, that you have multiple angles covered. And so it's just another way to kind of go about it.
But how much therapy is too much? I mean, that sounds like a lot of
It can
talking,
be.
a lot of emotion.
Well, I mean, you can have individual, you can have family, you can have
Oof.
coaching, you can have right, you can have a lot.
It
But I
sounds-
think what
Well-
happens, I think how I try to approach it is, I understand it's time and money. And so I let people know, like, hey, look, you don't have to use the time and money to do that right now. But it's also, you got to think about where you are in life right now. If you're at a crossroads, you probably need like some support. So and that might mean multiple support. And you get through it, then all right, you don't need as much. But if you say, like, I'm just gonna figure this out on my own, I don't know about y'all, but I've been in situations where I made some not so great decisions because I tried to figure it out on my own. And if I had just maybe listened or talked to somebody, which I learned, I would have made better choices, better decisions. And I just see it, like, some people they end up dating the same type of person, or they get hooked in the same type of situation. And if they had just maybe talked about it, processed, had some support and to help them have the courage to do something different, they maybe wouldn't have been stuck in the same kind of pattern.
Yeah. Yeah. And I guess as a follow-up to that, I guess, how does that work? Like, I mean, do you do an initial assessment and then you say, okay, you guys need to meet weekly with me, or is it like, well, or is it, this is the money I have to offer. So you can say, oh, you can afford one every month for 12 months. Like, how does that whole process work?
Yeah, to the money part, I try not to tell people what to do with their coins, right? I kind of say, like, this is my rate. You decide what you want to do with it. Now, there are times where I'll say, that doesn't mean you have to see me. You could see somebody else. And I try to give people options. These are people who might charge less than me. These are people who might take insurance. These are some other places. But no matter what, I strongly encourage that you see someone. That's my way of saying, yeah, you need to talk to somebody, right? And it doesn't have to be me. Lots of therapists have different ways they go about it. There's some therapists who do a really full assessment, a biopsychosocial that might take maybe the first session or 2 or 3, getting lots of information. And I personally think that's really important and valuable. That's not the way I practice. And I don't practice that way because I just got to the place where I realized people come to me because they really want to kind of start to work on the issue. And I feel like I will learn those other things along the way. Now, there's sometimes 6 months into it, I'm like, why didn't you tell me that? I wish you had told me that your parents were like on drugs all your life. That would have helped in some of the stuff we talked about. But I didn't really ask that either, right? But we did a lot of good work in the first 6 months. Now, so once again, there's some folks who would have gotten that information up front, but it would have maybe taken 2-3 sessions, and the person or a couple or family might say, I'm paying you a lot of money just to answer a bunch of questions. And I don't feel like we're actively working on it. So it's a process either way. But how I get to the place of telling people or encouraging people to think about individual is that usually I get a sense that, like, hey, something is coming up that seems personal to you. If they're coming to me for couples, because I also see individuals and I have a lot of folks that I work with one-on-one. If they come to me as a couple or in some other way, usually something is coming up that sounds like this is more of a you thing than a we or a full family thing. And then I might encourage them to say, this might be something for you to work out. Oftentimes I'll just say I'm working with a couple, I'll say, I think you both could work on doing some individual work, which is true. Sometimes one person might be a little bit more stuck than the other. But I think it can always be helpful.
That's good. And I think that a lot of times we kind of go into therapy like, I want you to fix me. Like, I'm here, I'm paying this money, and we had a session, and why I still feel this way, why I'm still acting like this, why my life ain't together just yet. So I wonder, what do you expect? Like, what's the work that clients have to do, or what's the expectation from the therapist for the person to see the results that they want over time, because it's not going to happen in 1 or 2 sessions, I suppose. It didn't for me, actually. So.
Yeah, there's been maybe 1 or 2 times where I think I had that miracle session that I was like, all right, I did everything, 1 session, boom, done, out,
Wow.
leave. But that's not really how it works. And actually, just today, an article came out in New York Times, says, "Does therapy work?" And I think it's really interesting just looking at it. And my take on it is that therapy does work, but like anything else, it works if you are also doing work, right? Like, there's nothing that like you can be prescribed the medication, but it's not going to work unless you actually take it. Like as you all were talking about the importance of taking medication earlier, or you can take medication, but there's also other changes that you need to make. Same thing with therapy. I think that what makes it really work is when clients come in, they're open to the conversation. And I know sometimes some of my work is helping people to become open. Like they're like, I don't know what this therapy thing is about. And then they see me and like, oh, all right, you're not so bad. Or like, oh, we actually laughed or we got to this actual thing and they feel better. And I think some of it is then what are they doing? Are they at least thinking about what we're talking about? Are they reflecting on it? It'd be great if they're taking like personal notes, right? Even if like in session or after, it would be great if they're like talking about it with whomever they need to and trying to practice some of these things, if it's skills or stuff like that, and then bringing it back. But most important, I think, is if they're willing to show up saying, "Hey, I want to talk about this," or "This is what I've been thinking about," then we are working at it. It's the
Mhm.
hardest if they expect me to do all the work because I'm not. And two, that's not going to help them to feel like they're really accomplishing something.
I think that's important, and I really appreciate you for mentioning that article. I know that Dr. Thomas is getting it into the chat for everyone. If you want to look a little more into the research, does therapy work? I believe it works. I'm still married, y'all, and that's one piece of evidence because I almost wasn't. So that's at least one piece of
Yeah, but
evidence.
y'all put in the work, right? Like, since you out yourself, you put in the work.
Yeah,
So
we
that
did. We
matters.
did. Um, Now, I want to ask, how do you know that a therapist is a good match? I always recommend to Black people, I'm like, try to find a Black therapist. For me, that's really important because I just don't want to have to explain the cultural nuances of our lives to a person. That just takes away time and it's annoying. So I don't know. So how do you know that a person is a good match, and what do you think about Black people looking for Black therapists?
Yeah, so to the point of like, how do you know what's a good match? I think with anything, it's about fit, right? And so you think about what feels good for you. Sometimes it's personality, sometimes it's perspective, sometimes people want homework, sometimes people want to just think, or sometimes people want to practice. Like all those things are things that you can ask. You can ask in the process. It is a bit of a interview, and maybe if it's not right before, maybe that's what you learn in the first session, but it's important to at least try it. And fit can also be around culture, around race. There are some things that if two a black therapist and a black client might feel like, all right, you get me. Now of course black folks are diverse, right? So just because two people are black doesn't mean like I fully get your whole story or I know everything about you. But there might be some pieces that you might not have to talk through, or it might just feel comfortable, even if the person, like, it could be a black person from like Germany and has a whole different context. But just because two black folks, you feel like, I just feel a little bit more comfortable, and that's okay. Sometimes it might be because of gender or sexual orientation or faith. There could be lots of things. For me, I actually just accidentally took it down, but it's right here. I often have my flag in the background,
I
right?
saw it.
Yeah.
Right, and I'm surprised of how many people will say, "I saw your Jamaican flag." And that either sparked a conversation where somebody said, "Oh, I got married in Jamaica, and that made me comfortable with you," or "I have family from the Caribbean, and that make," or all the way with them saying, "I'm Jamaican," and they said, like, "Look, now because of the flag." That's about fit, right? Something about me, right? Even in the background, whether that I'm married, whether that I got like, like minions on my, like all the stuff that some of that is just saying can I feel comfortable with you?
Mm-hmm.
And I encourage people, one, to just try it. Don't get caught up on like, should I or should I not do it, but try it. And along the way, you can then decide what is your fit. And I've told some clients, I've said, look, if you like homework, tell me, and I can tailor that to you. I can give you some homework. If not, I'll do my other stuff. So some of that is what allows people to feel really connected.
That's good. Now I know that Dr. Thomas has a question, but I see a question from
In the chat.
the chat. TJ the King. Hey Thomas. He said you need to talk or see someone. Can be a bit cliche to some. Any thoughts on why the Black community views therapy as negative, or why are they apprehensive in at least trying it?
Yeah, I mean, there's just a lot of history about people like taking our stuff, right? I mean, like I just got back from a trip from South Africa, and well, many things were profound for me. But one of the things is just so many things were just taken from the continent of Africa, right? From minerals and gold and diamond to people and bodies and lives and families, to even just the physical land was just taken, right? And is still being taken. And I think that there's this history of, if I share my information with you, what are you going to do? What are you going to do with that? Even to like, even more, US based syphilis study, right? And Tuskegee, and how like false information. So this thought of, if I'm open and vulnerable, somehow it's going to be misused. It's going to be taken. I'm going to be harmed. And there's just this theme of don't tell people your business, right? And so I think that's some of the history, but it's, in this context, it hasn't served us well, because then we hold on to it. Then we might deal with it in ways that are unhealthy, whether that how we emotional outbursts, or from drugs and alcohol to just even like relationships with food or sex. There are so many things that is maybe related to some other things that's going on with us. So this is where leaning into, I'm going to try it. I'm going to open up. I'm going to have a conversation. And oftentimes people say, the situation is not solved, but I feel better. I feel lighter. I feel different. And that helps me now to function, or to see the situation in a different way. So that's some of the history stuff. And yes, it's more than just go talk to somebody, but go find somebody who's good, who's a good fit. And the other struggle, where you're willing to maybe pay the money for it. We all might have different financial challenges, so I get that. And there's also ways that some of us will find money to pay for the things that we want. And so sometimes trying to move therapy into that place of, I'm going to make a way, or find a way to make it work, or find a therapist in my price range.
Thanks. And thanks for that question, TJ. Dr. Thomas.
I was going to ask the question that was in the chat, but which I'm glad that you asked. But I guess just one thing that came to mind as we were talking is that sometimes people who need therapy most, and I'm thinking about, those of us who are suffering some of the, multi-generational traumas of just different, atrocities in U.S. history or even world history, because we have, people from coming all over the world and may have had similar traumas in their, home country or their parents' home country. So it's like the response of wanting to be closed down and not, showing vulnerability. We might be the people who need it the most, and we're the ones that are like the toughest, nuts to crack. So I don't know if you have some reflections or thoughts on that.
Mm-hmm. Yeah, Dr. Thomas, thanks for sharing that, or putting that out there. I think that, once again, there's lots of things that bring us to therapy, and trauma is one of those things, right? Whether it's sexual trauma or sexual abuse, whether it's racial trauma and the injustices that people have experienced as a result of their race and culture, whether that's genocide or Holocaust, or impacts of slavery, apartheid. Like, these things are so massive. And this is my bias, for people to say like, oh, it doesn't have an impact, or even people who say like, oh, that was hundreds of years ago, or that was in the past, just get over it, is not recognizing that there were also systems that were set in place. There were also ways of thinking that are still relevant today and shows up for people, where people question, did I not get that job because I'm a woman? Did I not get that job because I'm Black? Did I not get that job because I'm gay? Like all these things that we question, and sometimes we need help talking through some of that and support. And what I haven't mentioned yet is that some of the stuff that we're talking about is just everyday life stuff. It can get to the place where it starts to create levels of anxiety, and that the anxiety now impacts how we show up. Or we could be depressed or bipolar, or we could be experiencing depression or experiencing bipolar, and that also impacts how we show up. That could
Mhm.
lead to places where we think about things like harming ourselves or other people, or just having negative self-talk. That these traumas, atrocities, these things that have impacted us and generations can really get us to the place where we don't feel like we can live a certain way. Even like the impact of poverty as well,
Yeah.
or where you might live or grow up, can make you feel like life is not worth living, or that I can't achieve greatness. And that is some of the reasons that therapy can be helpful.
Yeah. And
That's good. Oh,
can I
yeah,
ask
go ahead.
Dr. Motley really quickly too?
Mhm.
Something else that I just thought about is you're hearing more in media, and I'm sure the data have been around for a long time, but about some of the negative physical health consequences of just living in just a negative psychosocial space, right? I mean, just negative thoughts, like you said, or the whole living while Black, I guess, as they're calling it, and weathering and all of those things. I guess, do you know if there are data that, or if there are researchers looking into the possible protective effects of, therapy on some of these physical manifestations of just living in a heightened, awareness or anxious state?
Yeah, I think one of the key things that therapy does is it's a partner to let you know it's okay. That oftentimes when we experience racial trauma, when we experience a history of injustice, we often can feel like there's something wrong with me. And then the messages in our society or in our world further like doubles down and says, no, it's you. Like, what's wrong with you? Get over it. And then if you have the right fit with the right therapist, that person can help you to feel like, no, you're not crazy. You're not tripping. Like, this is not okay. You should not feel like it's unsafe for you to walk to your car or walk to the train to go a few blocks and feel like you have to hold the keys in your hands because a sexual assault could happen. That is not okay. Right. And just hearing somebody say that,
Mhm.
someone that you've now maybe developed some level of trust, can be helpful. Knowing someone says, yes, that you should not have experienced that because of your race. That, like, folks that I've worked with in corporate environments where they've had to like constantly show their badge to prove that they work there, even though they see the people every day going into the job, and they might have levels of seniority at that particular organization, that does weather and take a toll. And just having someone that says, yeah, that's not cool, that's not that's just absurd. Or even having someone be upset or angry for you, with you, or someone being able to say, that's not okay, but let's also talk about your drinking. Like, what happened to you is not okay, but you've also been drinking a lot. Someone that's able to do that. I think there is data, and from anecdotes to like actual research that says that has been beneficial, and that people then start to feel like they can make other choices or better choices as a result.
Great. Thank you.
That was good. I think that the one thing that I really like about therapy is I feel like you're listening. Like, I'm like, he is really listening to me, but I don't listen to a word I say. But somebody out here is listening, and it's just really impressive.
Well, she don't mean that, but go ahead.
It's really impressive how therapists listen, and you can tell that they're listening. Like, they activate those active listening skills, and it's impressive. So that's the thing that I like about it. But I guess to close out, if a person is considering therapy and they're starting to think about it, what are the next steps? Like, what are the best next steps a person could take if they're like, maybe I could give this therapy thing a try?
Yeah, I appreciate you talking about listening, and it is a skill to develop, and that I try to work on. I probably do it better sometimes when I'm actually at work than maybe not at work. Uh, but it is important once again to feel heard, and I think that sometimes we're looking for that. So for someone, once again, who's looking for a therapist, looking for a good fit, that's important. There are lots of ways that you can do that. There are lots of people who are doing the work. There are people that you can find. A good amount of therapists have used a resource called Psychology Today. And so if you go to psychologytoday.com, kind of anywhere you are, kind of in the US, you can put in your zip code and a list of therapists will come up. And they've actually grown in their ability then to say, like, if you're looking for a therapist of color, if you're looking for a therapist that identifies as queer, if you're looking for a therapist uh, uh, that works, that is of faith or works in this population, you can kind of select that. And then you can actually look through some of the therapists and look through their bios. What I encourage people to do is like maybe pick 3 or 4 and then kind of reach out to them and see what it's like and ask them some questions. The best way is really to ask those around you, because most likely people who you're connected to, as they're either seeing a therapist or they have seen a therapist or they know a therapist. And that's how a lot of people have reached out to me and say, like, hey, how do I, go and find out about this? And I have a referral list. I will send people a list of names and for them to go, people I trust. And so those are like probably the 2 ways that I would suggest to find a therapist is psychologytoday.com, and also reach out to the people in your network. Probably the third thing is anyone can reach out to me. I'm more than willing to kind of give them some resources. It's very easy. My contact is assistant@georgetalks.com, assistant@georgetalks.com, or you can find me at my website, georgetalks.com.
First of all, I'm supposed to ask you how people
I
can get
know.
in
I just
contact
figured I'd
with
just
you.
throw that in
Nobody
there.
asked you to
I
drop.
figured.
No, that's good. So I know that Dr. Thomas put all the resources in the chat, the link to Psychology Today, as well as your email address and your website, so y'all can get that out the check. But when I was talking to Georgie, the street practitioner, about this show, one question he wanted to know was, how does pet therapy work? He does a lot of work with incarcerated people, and apparently they've been bringing in pets to help them. And so he was just wondering, how does it work?
Yeah. So I would, and this is the other thing about when you're thinking about a therapist, hopefully they can own the places that they are good and maybe the places that's not. So pet therapy is not the thing that I do. I know therapists who have pets in their office or part of their work. But the overall premise is that there's a way that we can care for pets that brings out a different parts of us, right? So even with some folks that are incarcerated, the ability to care, feed, walk, love, pet an animal brings out sometimes, for lack of a better term, a softer side, a more compassionate side. Sometimes just being in the presence where we see like therapy dogs or animal support, companion, support is around that. There's a way that this animal provides comfort for me, that when I'm feeling anxious or overwhelmed, I can get this support from the animal. And those are things that are reasons why it might work and has worked and has been growing. My only thing is that maybe because I feel like sometimes people have done too much is that people now say this is my companion pet or my therapy dog when it's really just their dog, right? It's not really like it's not trained or anything else like that.
That's funny.
Uh, but once again, animals bring people lots of joy and comfort, and I think that's how it's become a pretty big thing that people do.
Well, thanks for giving us a little light on that. We just wondering what these dogs be doing up in the places all the time. But let me stop before I get in trouble, because I'm not a dog person. But thanks for coming on the show today, Dr. James. Always good to see you.
Thank you. Thank you. It was a
Thank
pleasure.
you. Thank you both. A pleasure being here. Thanks for the opportunity to just come and share and talk about therapy and mental health awareness month on the last day, getting it in. I made it. I made the cut somehow.
made
You know,
it.
you had everybody else, but finally I decided to get
Oh,
on.
child, please. You be on the news, you gotta get on Fox News, and then you can have an excuse.
That's it.
Nah, but I'm glad you made it on. So thanks again. All right, let's get into what is happening coming up over the next few days. We got a lot coming up. So y'all know COVID is still out in these streets. So we are going to be doing some COVID education and outreach at Trinity Transitional House event on Sunday, June 11th. The flyer is there. It's at 9th and Curlin. It will be there from 11 to 3. Also, for all my brothers, come to Brother with Local 413. It'll be right there on 291 in Chester. That's June 16th. I think it's from 5 to 9 or 6 to 9. But the flyer is there. So check that out. Come through. It's going to be a good event. They're going to have jazz. They're going to have all male providers. The street practitioner should be in the building. So make sure y'all come to that. That's going to be nice. And then I have the pleasure of speaking on a sustainability conference panel and the impact of environmental racism. So that is a free event, June 8th. So register for that. Come through and know how the world impacts your life. That's all I'm gonna say there. But everybody, please be safe. I got some texts recently about people that are testing positive for COVID. So COVID is still in these streets. Make sure you're protected. Make sure you are up to date on your vaccines. A new booster came out in the fall. A lot of people didn't get it. It's not too late. You can get your booster, stay up to date. And especially make sure your parents, your grandparents, your aunts and uncles, if they're 65 and up, make sure that they know that the CDC is recommending another booster for them if it's been 4 months since their last one. So that's a big one that a lot of people don't know about. So we got to do our best. Y'all can't say y'all ain't know. So thanks for watching. Thanks everybody for tuning in. And we will see you all next week. I'm glad to hear you are protected, and thanks for being so honest here on Keeping It 100, because that's what we do.